Hello, my name is Dr. Simon Freilich, consultant in clinical neurophysiology. This series of videos will provide an overview of the causes of foot drop and how it is generally managed. As you will shortly discover, there are many potential causes of this condition, and specific treatment will depend on the underlying cause. Whatever the cause might be, the immediate management of a foot drop is really important in preventing further harm and complications. Unfortunately, in my experience, it's often forgotten about, and so I've decided to start this series by talking about it. But firstly, what do I mean by foot drop? The ankle joint is stabilised in motion by a number of muscles to prevent the foot dragging against the floor when we swing it forward. The most important muscle in doing this is the Tibialis anterior muscle, known as the TA muscle for short. The TA muscle is a big muscle located in the upper shin. Its tendon reaches down and pulls up the bones on the top side of the foot. Failure of this muscle to work properly will leave the top of the foot weak and droopy on the forward swing. Hence, this is called a foot drop. Patients either end up dragging the foot against the ground or having to raise their leg up to an unnatural height to avoid tripping over. When this occurs, this is called a high steppage gait or a high stepping gait, depending on where you are in the world. Now let's talk about the immediate management, because whatever the cause, it can take at least a couple of months to heal, and patients with drop foot from whatever the cause and reason, at whatever age, are at high risk of falling. Falls, and even the fear of falling, can be very functionally limiting and disabling. When falls occur, these can cause significant pain and potentially serious harm, such as fractured bones and even head injuries. Always consider the following 3 items: footwear, floors, and foot splinting. Number 1. Footwear. All patients should be advised to wear good footwear. This means checking that the soles aren't split at the front. This can cause the front of the foot to catch on your flooring surface if the foot is being dragged along it. Patients should also consider the quality of their indoor footwear, especially those patients wearing old slippers. It goes without saying that flip-flops and open sandals are problematic because their soles are quite liable to catch on the floor. Number 2. Flooring. Patients must avoid any clutter on their floors which can lead to tripping. This includes anything that causes unevenness on the floor surfacing. Rugs and mats are easily forgotten about, but can cause falls if feet catch on their edges or if they slide on a slippery surface underneath. Number 3. Foot splinting. These should be arranged by your doctor. These devices are also known as ankle orthoses, and a referral to your local orthotics department needs to be arranged to fit you with one. If your doctor or specialist have inadvertently forgotten to prescribe you with one, I strongly recommend that you contact them for this to happen as soon as possible. I will talk more about the options available in greater detail in subsequent videos. So just to recap, first aid management includes footwear, floors, and foot splints. For causes, investigations, and further management, check out the subsequent videos by clicking on the iCard above.